most, but not a significant increase in your weight. I don't know if maybe the reason that we associate the birth control pill with weight gain is because a lot of women, teens, start taking the birth control pill right when there's a lot of changes in their body anyway. And so they're going through this change where maybe their body mass is going to increase anyway and blaming it on the birth control pill. But all the studies say that no, it does not significantly change your weight. Side effects of the birth control pill, there actually are very few. I mean, if you're healthy, normal blood pressure, no medical problems, the birth control pill is a very safe thing to take. The biggest side effects, however, would be increased risk of blood clots. But on the other side of the coin, what you need to remember is pregnancy is much more dangerous than taking the birth control pill. Your highest risk of ever having a blood clot is during pregnancy. And so it's kind of funny to me when you say, I don't want to take that birth control pill because it's going to do this. You know, well, pregnancy does more. So it's safe to take. We do monitor your blood pressure. We do monitor to make sure that you're healthy before we put you on the birth control pill. The birth control pills today, they're lowering the dosages more and more in the birth control pill, and they're finding that it's still just as effective in preventing pregnancy, but it's exposing your body to a lot less hormone. And so we try to start people on a much smaller dosage of birth control pill and see if that agrees with them. Now, it's going to prevent pregnancy, but sometimes the more we lower the dose of your birth control pill, that can cause some breakthrough bleeding. So, depending on your body, if you tolerate it well and you don't have the breakthrough bleeding, then the lower dose birth control pill would be a great thing. If you have a lot of breakthrough bleeding, so you're taking your pill every day just like you're supposed to take it, but you're not supposed to have your period for 2 more weeks, but you start bleeding for a couple of days. That's what we call breakthrough bleeding. You're bleeding at a time of the month when you normally would not. And sometimes that can be because your birth control pill dosage is too low. And in that instance, sometimes we'll put them on a little higher dose. But it's very safe. So the birth control pill is known to actually decrease your risk of ovarian cancer, because the way the birth control pill works, it's resting your ovary. It's providing your body with the hormones that your ovaries normally would make. So if your ovaries don't have to make the hormone because you're taking the pill, the ovaries are resting, which means that decreases the risk of forming cysts, and when the ovaries are at rest, that decreases the risk of ovarian cancer. So they actually are good for that. It decreases the risk of endometrial cancer, which is cancer inside the uterus. And the way it does that is because it prevents the lining inside the uterus from ever becoming thick. It keeps it nice and thin. So it does that as well. The biggest side effects that people complain about would be maybe some nausea when they first start taking the pill. Maybe a headache when they first start taking the pill. Usually I suggest if that's happening to you, take your pill at night before you go to bed, and then you fall asleep and you don't notice all those things because you're sleeping. Usually if you stay on your pill for 2 to 3 months, your body kind of just adjusts to it and you get used to it and you don't even know.